Imagine trying to take a photograph of something moving. Most likely, it'll look blurry in the image. So imagine a PET scan. A patient is actively breathing during the scan, and then you're trying to take a picture of a very small lesion within that patient. It's the same challenge. So there is current techniques out there to compensate for motion correction, but they're cumbersome. There's usually a box that you put on the patient's chest or a belt that you put across the patient's abdomen, but it creates patient anxiety to add one more piece of equipment onto the patient. They can error out. They can cause challenges in setup time. So a lot of people don't use motion correction techniques. Over 50% of PET scans are actually impacted by motion, but less than 5% of PET scans actually use motion correction techniques in their imaging. Introducing MotionFree PET CT, the first ever digital respiratory motion correction. It does not require an external gating device. It uses the data to see the respiratory signal, so it understands if there is some respiratory motion within the patient that would impact a lesion. It seamlessly integrates for every patient in every exam. It's always on, and it'll always correct for motion if your patient needs it. MotionFree PET CT, the first digital respiratory motion correction for every patient, every exam.